Good morning. I had a customer ask about knee pain today, so I wanted to jump on a quick video and talk a little bit more about knee pain. Now, the question that was asked was not actually for knee pain. It was actually for, can you give me an orthopedic doctor that I can go to because I have cartilage damage? So insert me. I'm the owner of Stretch Physical Therapy and Total Wellness, and my purpose, mission, and vision is to be able to help people understand their body and understand where to look for conservative care. We spend way too much money in our society now jumping around to an orthopedic surgeon, and he is going to diagnose you, possibly tell you that you have arthritis, possibly tell you that you have a tear or damage, and how scary is that? That visit may be covered by your insurance, may not be covered by your insurance, and may cost you, and then may lead you to more costly things like x-rays and MRIs that are not always necessary. So when it comes to cartilage damage, meniscal tears, and arthritis, which is osteoarthritis of the knee, all three can be healed naturally. Now the arthritis is there, so that gets a little tricky, but you can get mobility and improve the pain so that you don't damage further and so that you're not putting yourself at risk for a total knee replacement. So if you're looking for conservative care, I'm going to talk about knee pain and those three aspects in this video. So listen up. Okay, number one, the osteoarthritis. So osteoarthritis is a bony growth. Inflammation increases this bony growth, and it grows between two surfaces in the body. Now, when I say surfaces, you can pretend that this is the tibia, which is the bottom part of the leg. So the knee, the kneecap is here. This is the femur, which is the top part of the leg. And in between there, if you open those up, there is a cartilage that's on top that goes in a circle that is called the meniscus. Now that meniscus' whole purpose is to provide cushion in between the two joints, the femoral joint and the tibia joint, okay? When you walk and stand, you press on that cartilage, and over time, because we stand a lot during a day, you can actually damage that cartilage by twisting, and I'm not going to get into the mechanics of all of that, but just because there's a meniscal tear does not mean that surgery is required to fix it, okay? There are natural treatment options, and your body can heal. So that is the meniscus. Arthritis starts forming in between those two joints when there is damage. So it could be a tear, it could just be a trauma. Maybe you tripped, maybe you sprained your ankle and it affected the knee. Maybe you're getting older, and all of us get these aches and pains from aging because our body, it's not breaking down, but it's not as strong as it used to be. So it places pressure on either the inside of the knee or the outside of the knee. And what happens when you start getting arthritis in there, the joint actually restricts, and the knee is supposed to not only bend forward and straighten and lock out, there's also a little turn mechanism that's in there. And when you have arthritis or another injury, then that turn mechanism locks up. And so typically what we see in the clinic is there's an effect at the hip as well as an effect at the ankle. And I won't go into what that effect is in this video. Just know that your knee is the center force between your hip and your foot. And because those forces above and below will cause a rotation at the knee, when there's a rotation, you can have extra friction on either side of the knee that can cause damage in the meniscus, but can also cause degeneration to occur. And when that degeneration occurs, if you catch it early enough, even when you have pain, it's early enough, then you can actually unlock the joint at the knee, unlock the joint at the hip. We need to go a little higher and look at the back as well. And then go down and either unlock the ankle or stabilize the ankle, and then stabilize that entire kinetic chain so that when you stand on it, that pressure is placed more in the center appropriately than on the side where it's causing that damage to occur. So an evaluation is necessary to determine what exactly is going on in the knee, to decide whether there is an actual tear, to decide whether it is osteoarthritis, or to decide if you have other things that could be going on in the knee causing pain. You need to determine where the pain is coming from, what is causing it, and what successful treatment looks like for you. At our clinic, successful treatment is the use of a deep thermal laser to provide healing to the cell, to the injured area, so that you can heal naturally. We also do grade 4 and grade 5 mobilizations at the knee, the hip, the back, and the ankle. And then directly following that intensive manual work, and that means hands-on, we do some magic work to get those parts moving again. Once those are moving again, we provide you with exercises in the clinic that will stabilize those joints to take the pressure off. And then we put you in a program to help improve the mobility, improve your strength, heal the area of damage, and then get you back to doing the things that you love, whether it's just climbing the stairs or whether that's a 5K or a triathlon. We want to get you back to there. So I hope this video helped you understand knee pain a little bit better. If you should have any questions, please feel free to reach out to me anytime, 513-874-8800, and we are here to help you as much as possible. Have a great day.